My name is Nicole, and I was looking for a plastic surgeon to help fix the under eye bags I had. As I was getting older, I noticed that my eyes looked more tired, and I wanted them to be rejuvenated. Well, I tried filler before. The filler worked great, but it's temporary, and I also feel like the effects long-term just aren't what I want. I'd rather have something more permanent in my natural skin to be rejuvenated, not just like a Band-Aid. I ended up getting a fat transfer to my lower eyelid to plumpen up under the eyes and make it more youthful, to give back the collagen and fat that you lose over the years. And then it's a more permanent fix than just using a filler every year or so. You save money in the long run.
So just talk us through the whole process. So you had this thing at the beginning where you were like, okay, yeah, I'm looking in the mirror and I want something. From there, just in your own words, what happened? Like, how did you go through the process? How'd you end up here? How was the procedure?
Okay, so in the beginning, I just felt like I was looking really old, and I wanted to find a doctor who could help make me look more youthful. And so I started the search online, and I came across Dr. Athré, and I really liked his website and his Instagram, so I made the appointment, and then I came in. I thought I would need like something else done for the lower eye, but he's like, no, you need a fat transfer to plump it up, you know, underneath your eye, and the CO2 laser to help get rid of the fine lines and wrinkles. And I've heard of the CO2 laser before, and I've been interested in that as well. So I set up my appointment. I was excited. Not really nervous, just because I knew that I'd be under local anesthesia, so I would know what was going on. And he talked me through the steps, so I knew what was happening every time, or what was going to be expected, like the next like incision or whatever it would be. And then after the procedure, I wasn't really in any pain. I was able to walk. I felt fine. I did want to rest though. And then I went home, and I didn't wash my face until the next morning, because I also had like microneedling with stem cells to help with the overall appearance of my skin. And then I started using the serum and a light moisturizer that I was given, and that helped with the healing process and the red light therapy, or elixir, I believe it's called, that they use here, that I would come every other day. And then I felt like I looked better, even though I had all redness under here and burning from the CO2 laser, but I could see that the fullness was back under my eye. And that was a very good feeling. You know, I felt like I regained my youth again.
Why I'm smiling is this. So I find that women are so detail oriented. Okay, my wife's the same way. So if I ask her to tell a story, so you guys use these details, like I used the serum, I did this after this. This is why I'm smiling, because it's cute to me. So you've crossed the Rubicon. Okay, so all of those ups and downs and all this kinds of stuff. Okay, first thing. Now, you've never had facial surgery before, so you don't have a benchmark to benchmark it against, right? But you are a researcher. You've seen stuff online, okay? and you had a very, and you can tell, you had a very intense laser treatment. I mean, you could
Yeah.
see it. It was not...
No, yeah, it definitely was.
It was not this little, hey, let's just lightly, da-da-da. Okay, I mean, it was, let's barbecue her. Okay? Despite that, okay, so this combination of protocols that we created for you, the skin, the serums, plus elixir, how do you think it helped, hurt, sped up, slowed down your post-operative period?
I think it all helped with the healing part, to follow the regimen, and to know after like 10 days I looked like completely like I hadn't had something, surgery or some kind of cosmetic surgery done under my eye. I could put makeup on. 10 days isn't really that long for the long-term effects that I'll have. And it's worth it. I highly recommend anyone to do that who feels that they need their eyes rejuvenated or to be lifted, because it fixes the problem and you don't have to worry about it every couple months if you need Botox or if you need to go get filler or if it migrates. It's an amazing procedure that it's amazing what they can do nowadays.
Do you think I'm the only person in Houston and only the second person in Texas that is really gung-ho about elixir, because I really like my patients to heal as quick as possible. I don't want to do less surgery and say, oh, you healed quickly, but realistically I did less surgery. I want to give you your result and I want you to heal quickly. Do you think the elixir helped the overall process?
I do. I'm a big believer in red light therapy, so it's like red light therapy on steroids, and I definitely feel that it helped because I could see the improvement every day.
Awesome. Sign off words to somebody else sitting in your shoes. Now, I'm going to tell you a little bit about you, and I'm probably going to embarrass you. Okay? You are not my standard patient. Okay? My standard patient is way more anxious than you are. Okay? Is way more nervous. Okay? And you were a tough cookie. Okay, so I'd say if there's a bell curve, you're definitely on the awesome patient category. Okay, so you're talking to the population. Sign off words on your experience, or you can say anything you want to somebody sitting at home researching.
I would just say do it. It's worth it. Pain is beauty and beauty is pain. And I just think it's the best procedure for under eyes, or even if you have like the hooded eyes, to get that surgery, because it will change your life.